Here at the Brady Urological Institute at Johns Hopkins Hospital, we are proud pioneers in urological advances. Exploring new diagnostics, treatments, and protocols, we are reshaping the futures of men and women who previously had limited options. Here are 3 examples.
Since the first radical prostatectomy was performed here at Johns Hopkins in 1904, we have been pushing the boundaries. Upwards of 1 million men a year in the United States undergo a prostate biopsy, and many more face the uncertainty of a prostate cancer diagnosis. Urologists at Johns Hopkins have embraced a new biopsy approach called the perineal biopsy, which gives us some unique advantages to performing a prostate biopsy. These include less use of antibiotics, less infection risk for the patient, and an ability to sample areas of the prostate that are not approachable through the transrectal traditional approach. When we couple technology with this biopsy, we're able to then get additional diagnostics, including genomics and the latest in imaging technology such as PSMA PET scan, to obtain additional information for our patients. This information is integrated in our Precision Medicine Center of Excellence and our analytical platforms to give us the latest information that is specific to our patients. We use tools developed here at Johns Hopkins, such as the Parton tables, the Hahn nomograms, and our new app for active surveillance that helps predict when a patient requires another biopsy. And thus, we avoid overtreatment, we minimize undertreatment, and we're able to provide the patient with a management strategy for their cancer that fits their unique situation.
Another unique innovation at the Brady Urological Institute is the way that we manage chronic scrotal pain.
Chronic scrotal pain is a very common condition in the United States and consumes a large portion of urology practices. One procedure that we perform often that causes a lot of this chronic scrotal pain is the vasectomy procedure. About 500,000 procedures are performed each year, and unfortunately about 1 to 2% of these men will develop chronic scrotal pain. A lot of the pain that arises after a vasectomy procedure comes from inappropriate nerve signals that travel from the vas deferens nerves up to the brain. And the way that urologists have typically treated this using a procedure that's called a microsurgical denervation of the spermatic cord. Unfortunately, this procedure has about a 70% success rate. What we do here at Johns Hopkins that's unique is that we offer patients an image-guided approach where we identify the nerves with millimeter accuracy using a 3 Tesla MRI. We can take these patients into the operating room and resect their nerve fibers higher up and offer them much lower morbidity with their procedure by taking out those selective nerves.
Complex cancers demand complex teams to care for patients. Innovation focused on how we work together is improving patient outcomes and satisfaction.
Like Paul. Paul is a pharmacist and father of 2 who presented with a 20-year history of an inoperable benign tumor in his abdomen. When we saw him, he had been on pain medications for over a year and could no longer eat. We quickly evaluated him, ran some advanced diagnostics, and realized that he had a complex cancer that would require both systemic therapy and surgery. We initiated his therapy within that week, and a few weeks later, he had a 2-day operation and is now cancer-free. To pull this off requires capacity, commitment, and expertise. One such example are our GO teams.
A GO team is a team of 25 individuals who all mobilize to provide timely, guideline-based, complex care. This includes surgeons, oncologists, nurses, as well as hospital administrators. All of these individuals have signed a pledge guaranteeing that patients can be seen in 2 weeks.
Complex care can involve surgery, advanced diagnostics, or medical therapies. We make sure to deliver all of these under the umbrella of Johns Hopkins in a timely fashion.
Our work has changed the prospects for patients like Paul. All the individuals at the Brady Urological Institute have dedicated their careers to advancing the field of urology, much like we have for over 100 years. People saving people.